Well, first, I want to say, well, good morning, good afternoon, and good evening. I know there's people from different countries, different continents, so we're probably all in different time zones. That's wonderful, bringing everybody together here. Second, I wanted to thank the organization and the organizers to inviting me again to speak. It's always a pleasure to speak with the organization and be able to contribute to the service for individuals with autism. All right, so I'm going to talk about a topic that I've been studying a lot and being very interested in. It's about sleep, right? So I'm going to talk about sleep and some common issues and strategies for children with autism. But before I get started, one thing I wanted to say is that several things I'm going to talk about here today about sleep. It's not only for children with autism, it's for children with other developmental disabilities. It's even for children who does not have any developmental disabilities. So if you have young children who does not have any autism, any other developmental disabilities, this is going to apply to them as well. And for you as well as a person, many of these strategies that I'm going to talk here, if you have problems with sleep, it's going to help you as well. So that's why I love talking about this topic. But I will focus at some point about kids with autism and in some of these strategies, things that we need to think about when we wanted to address this issue. All right. Okay, so when we think about sleep, if you have a children, you think about your expectation is that it's going to be time to go to bed, and you're going to tell your child it's time to go to bed, and they're going to go put their pajamas and brush their teeth, and you're going to put them in bed, maybe read them a book, and kiss them goodnight, right? So that's the expectation. But many times, this is the reality, right? The reality is that the kids, they might not go to bed right away. They might cry. They might try to get out of the crib. You can see the picture on the top right that mom is sleeping because she's exhausted and baby is wide awake. Okay, so this is sometimes the reality for many parents and very common for parents who have children with autism. All right, so this is actually a real footage of me when I'm sleep deprived, okay? So every time sleep deprivation, it can be problematic. It is problematic, not only for kids with autism, but anybody, right? If I have only a few hours of sleep, that's how I look like in front of, and I have to work in front of the computer, that's how I look like. Have a big puffy eyes, barely know what I'm doing, might be slow in responding, my judgments are not very good, because of that sleep deprivation. Okay, so everybody will suffer from that. All right, so let me talk a little bit about the characteristics, the behavioral characteristic of sleep. So there's some very obvious characteristics that are related to sleep, that are that defines sleep. One is a reduction in motor activity. Of course, it's very clear children who's awake, they move around much more than when they're asleep, right? They're typically laying down, they might be even sitting, sleeping, but their motor activity is much more reduced. Second, there's a decrease in interaction and responsivity to the stimulus in the environment. What that means is that when a child's awake, somebody enter in a room, they hear a noise, they respond to that, right? They might look, they might ask questions, they might, make noises, and they will respond to things going on in their environment. When they're asleep, they're typically not going to do that unless it's something very loud. They might awake, otherwise things might happen around them and they're not going to respond to those stimuli. The other very obvious characteristics are their postures. So they're typically laying down and having their eyes closed. And a fourth one is what we call easy reversibility. which is this capacity of coming out of sleep very quickly. As long as you have something that gets you out of the sleep, you will. And this is to understand that it's good for us to make a contrast. What do you see, for example, if somebody has passed out, right? Has lost their conscience. And when that happened, for you to come back to conscious, you need to have bring all your physiological state back to normal, or back to a certain state, to be able to bring back to consciousness. That's different from sleep, right? You might be asleep, something happened, somebody come and shake you, you wake up right away. Okay, so that's one another definition, and that is for us to differentiate from situations when somebody is actually passed out or have lost their conscience. All right, so I want to talk a little bit about how do we understand the sleep cycles, and that would be important for us to understand some common things that typically happen on somebody's sleep and on a children's sleep. Okay, so the sleep cycles, it starts on. So if you look at the left. Let me just point it here. Here, there's left where the arrow is. So the sleep cycle go from awake, then the REM, which is a rapid eye movement, then steps 1 through 4. The lower that you get into this steps, into this all the different steps, the deeper is your sleep. Another characteristics of the sleeps is that, so you start on awake and you go all the way down and you get to this deep sleep. So it is common so this is a typical sleep cycle for children, that they have about 5 very deep levels of sleep where they get to level 4 throughout the night. So that's kind of what will be a normal for children. Another thing is that once they get to the final level, the 4, then they start going back into the levels until they get to a brief arousal or awake. There is a little bit of awakeness, so that's the highest point where the arrows are pointing. So that is a little bit of a awake moment. Okay, all right, and this is one of the sleep cycles for young adults. So it's not very. The difference is how many. Number 4s, how many deep sleeps they get, but it's kind of, it have the same kind of cycle. You start, you go all the way down, and then you have some periods of awake. What did we take from this graph? What we take from this graph first is that the normal sleep, you need to get all the way to the stage 4, to step 4. One important thing is that typical all the restoration, the rest, all the important functions that happen in the brain will happen in stage 4. So it is important that we get to this stage 4. Another thing is that it is normal to wake up at night. So children actually do wake up at night. And it is normal to do that. So if you look at those cycles, they do have this short moments of awakeness that happen. So that will happen through the night. What is not normal is for not being able to go back to sleep. Okay, so this is waking up in the middle of the night is okay. Not going back to sleep is a problem, and I'm going to talk a little bit about that in a moment. All right, so why do we need good night of sleep? We need a good night of sleep to sustain life. So sleep has been shown to be necessary to keep us alive. In terms of children, children need to sleep for neurological maturation. There is a lot that happens in the brain, especially in young children, and a lot happens while they're asleep. So they need that sleep time for those to happen. So there is a growth and development of central nervous systems, which is essential for all the brain functions. And there's also a release of growth hormones that happens during the sleep. We also need sleep for optimal functioning of cognitive functions, of physical activities, and emotional as well. In terms of cognitive function, just want to break down what those means. So for example, you need the sleep to remember what somebody has learned. So if you learned something the day before, it's important for that good sleep to help you remember the next day or the next few days. For some executive functions, for example, planning, having decision making, self-monitoring your activities, those are important as well. For quick reactions, to perform work with accuracy and efficiency, and we can just substitute the word work for academics, for example, for abstract thinking, and for creativity. So sleep is important for all those activities. Also, children need sleep because parents need sleep, right? If your children do not sleep, parents cannot sleep. And that is so important because it comes down to several things when parents have their children with sleep problems. One is, of course, the children need their sleep for optimal functioning. We just saw that. They need that for health and to be able to perform well in their school or in their intervention. But also, if they don't sleep, their parents or the whole family sometimes do not sleep. And everybody needs sleep. As we saw, parents need sleep. They need to go to work. They need to care for the other children or the other family members. Their younger children need to go to school as well. So the moment you have a child who have autism and they have problems going to sleep, it's probably going to affect the whole family. So it is very important to look at that. So poor sleep has been shown to produce fatigue and daytime lethargy in children in particular. So you're going to see that in children's school age. They might fall asleep at their desk. They might not want to play or do anything that's too active. You might see a lot of mood disturbance. So children who might be upset or might be mad very easily because of lack of sleep. Cognitive impairment, so difficulty into learning or using cognitive skills, particularly at school. We might see that reflecting challenging behavior, particularly children who have autism, they might engage in more challenging behavior if they have poor sleep. For older children or even young adults, they might impair their ability to make a good decision. So they might have difficulty with impulse control and risk-taking related behaviors. And of course, they might have academic issues. All right, so this is a chart that is offered by the National Sleep Foundation, which provide the recommendations for sleep durations divided by age. So let me first orient you to this graph here. So this here on the left is the hours of sleep. So it goes from 0 to 24. Those are the hours in a day. On the bottom are the ages. So we start with newborn all the way to older adult. Here, the little colors means different things. The blue means the dark blue means what is recommended. The green means what may be appropriate, it may not. And yellow, what's not recommended. And you will see the age, right? Right in the middle, or the number that's recommended is the blue one, right in the middle. And the yellow one, the green one are the ones that, or the light blue are the ones that are in my work, and yellow, what is not recommended. So one thing that we noticed first is that it's not only too little sleep that's not recommended, but also too much sleep is also not recommended. Okay, too much sleep has been associated with a lot of some health issues, particularly weight gain, and it might be a result of an underlying condition. So it's not only that they, sleeping too little is not good, but also sleeping too much is not good. And one thing that we notice is that there is a general correlation with how much the age of the child and how much they need to sleep. So, of course, the younger the child, the more they are required to sleep, and the oldest you get, less, it requires less hours of sleep. I just want to make just few observations here. So when we look at the light blue, right, the ones that are like that could work. So again, there is a range, right, of hours that could work, and it then at this point it becomes individual. You might need children. For example, if we think about the toddlers who needs 11 to 14, they recommend 11 to 14. You might have children who might be okay with 10 hours, and some that will be okay with 15. And that then needs to be an individual child. If your child is sleeping 10, but there is having a lot of problem behavior that might be related to sleep, then that might not be appropriate for your child. The other thing that it's important is that it is common for children to take naps, newborns, infant, but it is known that it's up to 5 years of age. After that age, children should not be taking naps anymore. If they do, that will disturb their sleep during the night. So that's another thing you want to watch for. If your child is over 5 years old, they're still taking naps, you need to perhaps try to change those habits or understand why they need more sleeps. Maybe they're not getting their sleep at night. That's why they're doing it during the day, but then it's going to disturb. So it's not common anymore that children would take naps past the age of 5. All right, so autism spectrum disorder, it's neurodevelopmental disorder that has the main characteristics are social communication deficits and restricted interest and repetitive behavior. And so those are the defining features. Now, there is common co-occurring problems that do not define ASD, but tends to be commonly present in individuals with ASD. Some of them are tantrums, aggression, self-injury, hyperactivity, anxiety, depression, and sleep disturbance. In fact, the recent study has been able to track and show that 80% of individuals with autism has at least at some point in their lives demonstrated difficulties with sleep. Okay, and that's common across all age ranges. So here's some potential risk markers that are associated with difficulty in sleep in children with autism. And again, this is not definitive data, but there's some characteristics that researchers have raised that could be an issue. First, the core symptoms of autism. Given some of the symptoms of associated with autism, and those can be associated with fear-evoking stimuli and unpredictability of environment. So children with autism with the tendency of attaching to routines, of maybe getting upset when something changes. So if the sleep involves a lot of unpredictability, that can provoke them some anxiety and can disturb their sleep. Maladaptive coping strategies. So individuals with autism might have some difficulty or do not have the skills of soothing, of relaxing themselves, because we do need to do that, right? To go to sleep, you need to put yourself in a relaxing position to be able to sleep. And they might have some hyperarousal characteristics, which might make it difficult for them to fall asleep. So it's like this lack of strategies to relaxing themselves and soothing themselves. And there might be some comorbidities with medical conditions that might affect the sleep that can be associated with autism. Okay, so those are something to watch out for. Another characteristic is anxiety, particularly for perhaps older children or young adults. Anxiety will make sleep difficult. If they have higher symptom severity, if they have communication, social interaction deficits, they tend to have more sleep problems. Sensory sensitivity, of course, because then they get very aware of the environments of the stimulus in their environment, and for you to fall asleep, you do need to turn off, all you're paying attention to everything around you. Children who have developmental regression tends to show a little bit more problem with sleep, and gastrointestinal problems also, probably due to the discomfort, and that could also cause problems with sleep. And important to say that this association, these characteristics, and the problem with sleep, it's equally present in all age groups of children with autism. So there's like 4 major sleep difficulties when we start looking into somebody's sleep. There's 4 majors. There's insufficient sleep, poor sleep quality, inappropriate timing, and primary disorder. I'm going to talk about each one of them. But first, I want to start with primary sleep disorder. I'm going to talk about 2 different primary sleep disorders. First, I wanted to say that I'm going to touch upon them, but those are all medical disorders, okay? So the first one is the sleep disordered breathings, which is the obstructive sleep apnea. So the sleep apnea happens potentially because of the positioning of the neck, the way the child lays down. They might have the way that their respiratory system is structured. It might obstruct the air and make breathing very difficult. So typically, with obstructive sleep apnea, what you're going to notice is the children have difficulty breathing. They might try to pull the air too much. They might snore. They might make it's very laboring breathing. And of course, that's going to make them wake up a lot at night. And that's a big problem. If they wake up too much, they never get to the level 4. Remember, we need to be on the level 4 for optimum sleep and rest. So that will be an issue. The other one is periodic limb movement. They call the restless leg syndrome, which is exactly what the pictures show. It is avoidable, like irresistible need to move their legs. So the children would, have this need to move their legs, and they will move them. And that is not to be confused. Children move like when they're sleeping, they're moving. You might see them move the legs, but this is it will look different. This is like they have that need to move. And one way to tell the difference apart is that typically, if you mark the time, they will move their legs exactly in the same kind of a period of time. So, for example, every 2 minutes or every 5 minutes. So it's very periodical, and it happens in a constant time. And of course, that's going to cause them, if they do that during their sleep, that's going to cause them either to wake up, or they're going to have difficulty falling asleep because they're moving their legs. Now, I'm not going to address this further because those are all medical disorders. And if they need medical evaluation and to receive a diagnosis of any of these disorders, you might need an overnight sleep study. But it's important to know, because sometimes if you suspect that the child you're working with or your child have some of these issues, that needs to be ruled out first. So you need to address those issues first before you even go look into the other things we're going to talk about, these strategies. All right, then next one, I'm going to talk about sleep difficulties. And important to say that they might vary by age and the skill level of your child. The first one is bedtime resistance. Bedtime resistance is involves the child who resists to go to bed when it's time for them to go to bed. Okay, so you're trying, it's 9 o'clock, it's 8 o'clock, you're trying to put the child in bed and they resist. And there's different ways that they can resist and depends on the age and their skills. For children who can walk, maybe toddlers, they might just leave the bed. You put them in bed, they live, open the door and get out of their bed. For younger children, they might even engage in tantrums or other problem behaviors, when they say it's time to go to bed. For older children, particularly children who can speak and can reason, they might create some excuses for why they should not go to bed. And then you like at some point you're reasoning with them, but they can become more creative. Another sleep difficulty is dependent sleep or dependent sleep onset or bad sleep associations. So we understand our understanding of sleep is that we tend to create associations with how we sleep. Okay, so if you typically sleep with the TV on, it's very likely that you create an association, and every time you need to have your TV on. If you sleep in a specific position, you probably need to be on that position to fall asleep, or anything that's around your environment, very dark lights or some sort of music in the background. Okay. And some of these associations are okay, but some of them are not so good. For example, family member, a child who creates an association is sleeping always with the parents or always with the mom or always with the dad. So the issue with that is that when they wake up in the middle of the night, remember we talked about that we all wake up. When they wake up in the middle of the night, they need that same environment to fall asleep. Okay, so that is a problem. Then the child wake up in the middle of the night, they cannot fall asleep right away because mom is not there. So they go search for mom or they cry, mom needs to come. So that's not so, that's a problem of a bad association. Another one is feeding, children who really get into the association of, for example, fall asleep with the bottle. They might even be like 4 or 5 years old, but they need to fall asleep with the bottle. Again, they wake up in the middle of the night, they're going to have difficulty falling asleep back. And with objects, there's some objects that are good. I'm going to talk about that in a little bit. But falling asleep, for example, watching a YouTube video, that's not so good because they wake up in the middle of the night, they're going to want to watch the YouTube video, and that can be, if you have other children in the room, that could be disturbing. Or sometimes they might just get more alert if in the middle of the night they need an iPad. Another sleep issues is night awakenings. So it is, again, we talked about, is it normal to wake up during the night? What's not normal is not being able to fall back to sleep. And night awakenings, it's more problematic if bedtime's environment is different from the middle of the night environment. So if you sleep somewhere, child is asleep on the couch, and you put in bed, they wake up in bed, that might be problematic, right? Because they're used to sleep on the couch. Now they wake up in bed, and then they probably need to go back to the couch. Or the child who sleep in the parents' bed, and then parents put them in their own bed. Then they wake up, they're not in parents' bed, so they need to go back. Okay, so that is problematic. So you might have them move into another person's bed because that's where they fall asleep. That's the association. Remember the associations that we make when we fall asleep. And another thing, sometimes, particularly with older kids, if they wake up in the middle of the night, again, they have bad associations, they cannot go back to sleep. They might just get up, go watch TV or go play a game, and then parents might not even notice. And parents get up, and they think the child woke up earlier. They think they're being sleeping through the night. So that can be problematic in that way. Another sleep difficulty is the sleep duration. Children might be sleep too much, as we said, or too little. Okay, both can be problematic, and they are associated with some health issues, some cognitive issues. The sleep schedule can pose some sleep difficulties. One thing that's important when we think about sleep schedule is that we need to put the child to sleep at times when they're not. I'm sorry. Let me go back to this. So with the sleep schedule, one problem is when we put the child at bed when they're not tired. So that is problematic. Because if they're not tired, they might have sleep resistance. They might want to get out of bed. They might want to do other things. They might have difficulty falling asleep, and then they're gonna get up, or they're not gonna be able to fall asleep in their bed, and there might be problem behavior. So the better things to do in this case is to take the child out of bed and just put them when they're tired. And another problem with sleep schedules is having naps that are too close to bedtime. First, remember, after 5, they should not be getting naps during the day anymore. But the child who's still getting naps, if they have naps that's too close to bedtime, then they're going to have difficulty to go into bed. So that's important. And in terms of schedule, older kids who have activities that are late, they also might be coming home too late. I know some children who, might have soccer and goes until 6:30 or 7, and they get home, they have to take a shower and get dinner, and by the time they're ready to go to bed, it's quite late. So that can be problematic too. Some other sleep difficulties that we see is that's going to affect is daytime behavior, which is sleepiness. So that's particularly a red flag for school-age children. And it's very problematic behavior during the day. You might see problem behavior during the day. And, the same way that you see it during bedtime, you might see also during the day. So we know that biological process is the basis, but sleep patterns also develop in response to psychosocial factors. So let me talk now some factors that influence sleep, okay, and particularly good sleep. So the sleep routine. Sleep routine improves with predictability. The more predictable is your environment, the things gonna happen, the best you're gonna get your sleep. The first thing you need to do if you're trying to address your child with sleep problems is the constant sleeping, having a constant sleeping and waking times. This helps create good sleeping habits. So make sure they always go to bed at the same time and wake up at the same time. So of course, first you need to understand what are the hours, how many hours they need per night, right? So you go on that, you find that chart and you see, my child needs 10 hours per night. They typically need to wake up at 7 to go to school. So you need to calculate 10 hours back, which will be 9 o'clock. I know that it might be difficult on weekends sometimes, to wake up them at the same time, go to bed at the same time, but the most predictability you have, the most constant, the most consistency you have, the best you're going to have with their sleep. Screen time, blue waves has been shown to inhibit the production of melatonin. Melatonin, it's a natural hormone that we produce that helps us in 2 things, and help us fall asleep and help us maintain our sleep during the night. Research has shown that blue light inhibits the production of melatonin, and it can even, once you stop watching something, it can even take up to at least an hour for your body to start producing melatonin. So screen time, it's something that it's definitely gonna, watching TV or iPads, phones, all that might affect your child's sleep. The nap schedule. So the nap should stop by age 4 or 5. Children should not be having naps anymore. Extra naps might decrease the need to sleep during the time, so you need to be careful with them. Of course, the school start time. I know some countries, school starts quite early, and if children need to commute, they need to wake up very early. So that was going to influence, how much they're going to sleep at night. And eating habits. So drinking drinks with caffeine and sugary snack and drinks. And it's amazing how much of the processed food has caffeine. A lot of candies and chocolates and even other kind of foods have caffeine. So we need to be careful with that, particularly if they're drinking that in the evening or having that in the evening. So we know that behavioral interventions are the first line treatment for sleep if it's not medical. Okay, if the issue is medical, like the ones we talked about, then it will require a medical intervention. But if it's not, behavioral interventions can be very successful in helping children to improve their sleep. We know that sleep is highly treatable. It can be taught and help children also to calm down, follow instruction, and go to sleep independently and stay asleep. Also, parents are not sleeping if their children aren't asleep. So, if the child sleeps, parents sleep. So behavioral intervention can help with that. And also can help parents with their own sleep, with their child's sleep, and their sense of control. So sleep, we see in behavioral interventions, we see sleep as a learned habit, as a learned behavior, and with any habits, it can be taught, right? We develop new habits and we can learn new habits. So sleep is a habit and we can teach them. So one thing that I want to talk about in particular is sleep hygiene, and those are the tips, the things that can be implemented to help the children improve their sleeps. So change in behavior and environment can promote good sleep, and that is what sleep hygiene is about. First, we need to avoid the arousals, caffeine, screen time, particularly a few hours before bedtime, exciting play, leave the exciting play for during the day. The kind of plays that should be happening at night needs to be the more calm place because you might get the child too excited. Bright lights at night, you can start dimming your lights at night because that kind of helps the brain start thinking that is nighttime and producing melatonin. And of course, decrease noise and anything that might worry that child. You need to consider your sleep organizations. Avoid napping late in the day because that's going to get into the way, right, of the child falling asleep. Having consistent sleep and awake schedule. So make sure the wake and the time to go to bed, the time to awake are similar, like are consistent across the days. And lots of awake time in the bed. So you don't want to put your child when they're not tired to go to bed. You don't want them to be awake in their bed. You want them to go to bed when they're tired and ready to fall asleep. So again, keep consistency of your schedule. Keep bed for sleep. So if children has intervention or therapy in the bedroom, make sure it's not in a bed. The bed is for sleep. Do not set up a lot of play in bed because then you don't want to make those associations that, a bed is a fun place, that I'm awake, I'm playing. The bed is for sleeping. During their sleep time, the room, it's good if the room is cool, it's quiet and it's comfortable. And you want to put your child in bed drowsy, like almost asleep but still awake. You don't want to put, a lot of times parents like see their child are falling asleep on the couch and they pick them up and they put them in bed after they sleep. But that's no good because then the child just learned that they fall asleep in a couch, right? And then they wake up in bed in the middle of the night. What you want to do is, when they're almost falling asleep, they're still awake, then you put them in bed because then they learn how to fall asleep in their own bed. And they wake up in their own bed, they will learn the skills to turn and fall asleep again, okay? So but you also don't want to put them too awake that they're not ready to fall asleep. Okay. Include physical activity during the day. Physical activity is very important for children. It's important for sleep, but you want to, if possible, during the day. Avoid caffeine, of course. You can have something what we'll call a security object, like a teddy bear or a preferred pillow or a preferred blanket. Those are good associations that children can create, because those are good security and appropriate objects for the night. We don't want to have exciting toys or video games or iPads or things like that, but those other kinds of objects is fine. And you want to develop a sleep routine, and I'm going to talk about that. So a bedtime routine can improve bedtime resistance, right? When the child does not want to go to bed, and decrease night awakenings. So how do you develop that? First, you want to choose the activities. You might want to get maybe a light snack if you want to give the child something to eat, and it should be light. You want to consider less stimulating activities closer to the bedtime. And you want to make sure that it's predictable. Remember, our child with development with autism might have problems with unpredictability. So if you have a routine, it needs to be predictable. You can even use a visual schedule to show them what all the steps are. So here's an example. For example, you can get them to put their pajamas, then we're gonna brush our teeth, then you're gonna do some readings, and then they're gonna go to bed. Now, you know your child better, and you want to make sure the activities that take more time or more work, start earlier in a chain. So, for example, if the child has problem brushing their teeth, you might want to do that first, because they might get all excited, or it might have a little bit of some problems, or might take longer. So the ones that are easier, that is more calming, is the ones that's closer to bedtime. The ones that might take a little more time, or you might want to do it earlier. But you know your child, and you can pick what is important and what is going to work. And it's important that you have that plan, you create that plan, implement that plan. The more consistency you have, the more predictability you can have, and the more that's going to help the child to get prepared to fall asleep. What we understand is that once you create that routine, your brain creates those associations. When you start a routine, your brain starts sending signals that it's time to go to bed, and they start releasing melatonin. The child, actually, the body start getting ready for bed, and that can help your child to fall asleep. So what I just talked about was what we call sleep hygiene, and it is some general recommendations, again, that it can work for kids with autism. It can work for your child who does not have autism. It can work for your child who's adolescent and has problems. It can even work for yourself. Of course, your routine might be a little bit different, but you can, if you have a clear routine, that might help your own sleep. Cut your screens, do not have any caffeine, do not take naps, and all that can serve. Now, there is some more intense issues that can happen when children have a long history of sleep problems, okay? And that can be the bedtime resistance, sleep dependence, and that can be when they have a long history, or night awakenings. For all that, we do need a focused behavior intervention. Those will require a professional who have experience in sleeping, who can who can conduct an assessment, design a specific intervention, train the parents how to implement, and follow with the parents, okay? Because that might be a little bit more complicated. And unfortunately, it's not the focus of our talk right now, but it can be done. These problems can be resolved with behavior intervention. Just to finalize here, the last thing important when you're thinking about sleep, repetition and consistency, it's very important. So the more you repeat, things might take a while. It might take more than a week, it might take a month, but if you repeat and you're consistent, things tends to be very good. Be aware of the child's developmental stage, like how many hours they need to sleep. Do they have anything that's typical for their age to be afraid of things? So be aware of that. Also, make sure to start when you're ready, and because it might be very stressful for parents, because when you're trying to have them sleep, I'm almost done, Milka. Have them asleep. You might also have difficulty falling asleep because of all that. You might have more problem behavior. So just do it when you're ready, when you rested, and when you're committed to that. Parents, everybody needs to sleep. Parents need to sleep to go to work, to take care of their children. So it is okay, whatever you're doing right now, to have everybody sleep is fine. But if you wanted to make improvements, make sure you're ready. Make sure, maybe you have support, somebody to help you, because it might be difficult. So when you choose the time to do that, if you're traveling or on vacation, have a new baby or somebody's sick, that's not really the time to try to make those big changes. I have here some resources that informed my talk, and some other resources that parents can have if you want. That can be very important, very helpful. And this book is very interesting too, very helpful. Okay, thank you.
Thank you very much, Andresa. It was a very good presentation. I must admit, I completely could see myself many years ago, because I have 3 children, and all 3 of them never really slept properly until they were 2 years old. Now, when I look at a presentation, I actually understand it completely, because I learned it through the process. Now, we have some questions regarding the children who are in the spectrum. What would you recommend how to combat the sleeping disturbances with these children who are difficult to communicate with? And I mean, is there any interventions that are that you can find in literature that are recommended for these children?
All the tips that I gave, it's the first thing that we're gonna try. Okay, so it doesn't matter if it's a children that does not have autism or children who has autism. Right. So all these things, right? So have a clear routine, have a schedule. If your children use a visual schedule, use a picture schedule. If they, all those things, sleep at the same time, limit their screen times, do not give them all the same things you would do, right? That's the first thing. Then, as I said, there is other interventions that are more focused, and it requires more work, and it can be done. There is in the literature things that has been done with kids with autism. Not a whole lot though, but there is some, and there is strategies that can be done. But that will require a specialist, who have the skills, who are experienced in sleep issues, and can do an assessment and design an intervention, train the parents how to do it, take data, and be with them during the process. But yes, there is.
Thank you. That brings me to the second question, because we noticed that a lot of people from, a lot of children within the spectrum very often are prescribed melatonin as a supplement. So what's your opinion about that?
Okay. So first, so melatonin, it is a medical, I would not be able to prescribe because I'm not a medical professional. So melatonin, it's a natural hormone, right? That we develop, that we produce. And there is people who does have a problem with producing melatonin, and that is problematic. Then, because otherwise you can have good sleep. Now, I think melatonin will help, but if you don't teach good habits, you could use probably melatonin at the beginning. If you don't teach good habits, you're always going to have to rely on melatonin. And the thing is that melatonin is not only for falling asleep, but you need good melatonin levels to continue sleep. Now they wake up in the middle of the night. What do? You give them melatonin again, because they don't know how to fall asleep again. I think it is needed at some point again, but I'm not a doctor to talk so much. But I think teaching them good habits, it's the best way, because these good habits are sustainable. Melatonin, you're always going to have to do it.
Exactly. Yeah, I completely agree with you. I mean, this is not the solution to keep giving the melatonin all the time. Yes. Thank you so much, Andresa. It was a very, very educative and interesting presentation.